when life evolved on Earth, two systems evolved in parallel. One is the gut and the other is the brain. The purpose of life was to eat and to find something to eat. So the gut would eat, and the purpose of the brain was to find something to eat. That's why these two systems developed in parallel.
This physical health of the body itself and the activities you do have any beneficial effect on the brain?
The absence of movement can seriously harm your brain. So there are studies showing how if somebody is simply bedridden for 3 months, they can have a drastic drop in their mood. If say there's a 50-year-old man and he falls, breaks his hip, and he's bedridden for 3 months, the chances of him getting depression are much higher. Just imagine, just by not moving, you now have an increased risk of death. So basically what is happening is that you are scrolling on the phone, and because of the way that the social media algorithms are designed, it keeps your attention hooked onto the screen itself. And once you start to scroll, you're just there, you're just scrolling, you're not thinking about anything else. You are not using your brain anymore. It's rotting. That's what brain rot means. That makes you sort of a zombie. Depression is an inflammatory state. So when somebody is depressed, their brain is acting as if it is under attack, as if there is an infection going on, even though there's actually no infection going on. There is a chronic inflammatory state happening in the brain, and that is what leads to certain parts of the brain shrinking. Memory problems can happen because the hippocampus area in your brain starts to shrink in depression. There is a part in the prefrontal cortex called as DLPFC that is responsible for attention. That starts to shrink in depression because of chronic inflammation. So that's why you're not able to focus on things long. If you hear something, you'll quickly forget it. All of that is because of that shrinkage because of inflammation. So yes, chronic inflammation can have a direct impact on the brain.
Hey guys, I'm Tarun. I'm co founder of Orange Health Labs, and welcome to the Orange Club podcast. Here, we are going to talk about all matters around health, and we're going to make it easy to understand and even easier to act upon.
It's such a pleasure to have you here with us on the Orange Club, Dr. Siddharth. Thank you so much for joining us.
Thank you for having me. It's my pleasure.
Great. So, Dr. Siddharth, I just wanted to actually start with demystifying the part of science that you are part of, right? All of us, we go to hospitals and it's kind of common to go to like an internal medicine specialist. It's common to go to a cardiologist, or maybe even an endocrinologist, right? I've always found, neurology is a kind of a section that you're a little scared of approaching because it's like feels like a very advanced science and you want to get to it when you have to, right? So just to demystify this for people who are watching this podcast, right? Could you give us a little bit of a brief overview of what neurology is about, what neuroscience is about, and what does it cover essentially?
Yeah, absolutely. I don't want people to be scared of neurologists because neurologists are basically trying to take care of your brain. They're trying to keep your brain and your nervous system healthy. So when a neurologist is sitting in his clinic, most of the patients who come to them are people who have some sort of pain in their body. So that could be because of migraine, back pain, neck pain, because pain is an integral part of the nervous system. Or they could be someone with memory problems like Alzheimer's, or just having trouble remembering things because of stress. That is also increasingly patients who come to us. And then there are patients who have something wrong in the networks in the brain. So that can be things like Parkinson, where people have trouble walking, they're slow, they're rigid, or there could be injury. So patients who have strokes, paralysis, spinal cord injuries, or even nerve problems like neuropathy. So this is the entire spectrum of patients that a neurologist deals with.
Okay. And so in amongst all of these conditions, right? I think which would you say are like the most common ones that you see, and which of these you have started seeing, let's say, at a much more relatively younger age, right? So you start seeing it around 30s or late 30s, and then starts from showing up more towards the 40s. Like so, my reason for asking that question is that when does these things become relevant to a youngster? Of course.
That's a good question. So at different age groups, we have certain diseases which are more common. So if I see a 20-year-old or a 25-year-old, they would most likely be coming with some sort of pain. That could be migraine, headache. That could be neck pain, because nowadays everybody is working while sitting. They are hunched over their laptops. A lot of them come with neck pain or low back pain. There could also be problems with sleep. And this is increasingly more and more common because of the lifestyle that we have, the stress that we have. More and more patients are coming because they're not able to sleep properly. They wake up feeling tired. So sleep is a very big issue now. A slightly older age group, say 40, 45, they will have, again, low back pain is very common, but this is also the age where early signs of memory loss can start. So say 50, 55, you can have people who are just starting to forget stuff. It's too early to call them as Alzheimer's because Alzheimer's usually starts after the age of 60. But there are people who come with stress related, work life balance related problems that can lead to memory loss. And the older age group will have things like Parkinson, Alzheimer's, strokes are extremely common. So they can come with paralysis. So different age groups will have different problems.
That really helps actually understand the progression of how this field starts touching your life over your lifespan. Could you also give me a little bit of sense of about the what are the things about the brain and rest of the body's connection that a lot of people overlook, right, about themselves?
So I always like to say this story of how when life evolved on Earth, two systems evolved in parallel. One is the gut and the other is the brain. So the purpose of life was to eat and to find something to eat. So the gut would eat and the purpose of the brain was to find something to eat. That's why these two systems developed in parallel. So even now, if you look at a human being, you'll find that their spinal cord goes from the head to your buttocks and your gut goes from your mouth all the way to the buttocks. So they are both in parallel and they evolved like that. So this is not a coincidence. They evolved side by side right from the time when we were unicellular or multicellular organisms. From that time, the gut and the brain kind of evolved together. Although at that time, it wasn't called gut and the brain. They were just, like a neural tube and a gastric tube. The evolution of the brain since then has been all about movement. So the purpose of the brain is to figure out how to move and how to move more efficiently, how to move towards food and how to move away from danger. That has been the single purpose of the nervous system or the brain. So if today you were to ask what is the connection between the brain and the body, the connection is mainly movement. That is its sole purpose, which is to figure out how to move, where to move, and to understand what is there in the environment that can help us navigate it. So where is there danger and where is there something to move towards? So that is the connection.
That's very interesting. You put it like that. Does that mean people who are actually, what you call as, kinetic or kinesthetic intelligence, right? People who, say, get into dance or some kind of physical activity, do you think that has a reverse positive effect on the brain, the training your body that way? Because seems to be you're saying that the connection is with movement. Does physical health of the body itself and the activities you do have any beneficial effect on the brain?
Absolutely, yes. There have been multiple studies now showing how dance has a direct positive impact on the brain. It helps in neural connection. It helps to strengthen your brain's connections. It even helps to have an antidepressive or anti-anxiety effect. So people who dance regularly have a sort of a more resistance against having things like depression.
Wow.
Alternatively, people who are going through depression, there was a study that was published in the British Medical Journal showing how dance has an almost equal effect to medication in treating depression. Now, all these studies have to be taken with a bit of nuance because it is not as straightforward as dance and all your problems will get solved. It's not like that. But it plays a very big role. Movement plays a very big role. A better way to look at it is the absence of movement can seriously harm your brain. So there are studies showing how if somebody is simply bedridden for 3 months or 6 months, they can have a drastic drop in their mood. So if say there's a 50-year-old man and he falls and he breaks his hip, he has a hip fracture and he's bedridden for 3 months or 6 months, he can have the chances of him getting depression are much higher. In fact, mortality, matlab the chance of dying if you have a hip fracture is almost 30% in the first 1 year. Just imagine, just by not moving, you now have an increased risk of death because everything in your body and your brain are sort of wired to move.
Wow.
So if you stop movement, it's like a cascading thing. One thing leads to another. So all your metabolic problems will start, your sugar levels will start going up, your blood pressure will start going up. So everything will start after movement stops.
I actually did read some study online. I can't speak to the veracity of it, but it said that playing racket sports was actually a good way to like help with your mind health as well as your longevity as a person. I imagine it is because of the amount of coordination that you have to do. But like, what's your thoughts on that? Something similar or?
Yeah, that's absolutely correct because racket sports involve a lot of physical movement and it also involves a lot of hand-eye coordination. And anything that involves hand-eye coordination is good for you because it keeps that network active. It keeps you more agile. So it's not just racket sports. I would say that all sports will help in some way. But the reason that racket sports especially are good is because it also improves your reflexes. So things like badminton, tennis, table tennis, the ball or the shuttlecock coming to you is happening very fast and you have to keep reacting to something. So not just movement, but simply practicing reflexes is very useful because reflexes is the one thing that can save you from physical problems. So the reason that most people fall at an older age is because their reflexes are slow. Right? So the one reason is that their muscle strength is low, but a more important reason is that their reflexes have become slow as they age. So when you're falling, there is that one moment where you can catch yourself if your reflexes are good. So right now, if you trip, you will reach out or you will adjust your weight so that you don't fall.
Yeah.
But if your reflexes are slow, you will not do it in time and you will fall.
Yeah.
So that is why racket sports are good because they keep your reflexes sharp.
That's a fun way to like keep yourself healthy, I guess.
Of course, everybody should do it.
Yeah. So now you answer this question also in form of like by flipping it on its head by saying that like when you get a hip injury and that's an extreme example of saying that you become immobile and therefore you can lose your health that way. But what if I dial that down a little and I want to get your view on this thing. Does some kind of like chronic conditions, cardiometabolic conditions, or chronic inflammation in body, right? These are like less severe than saying being immobile, but these are like kind of chronic situations that you're dealing with. Do they have an effect on your brain health?
Absolutely. So any chronic inflammatory condition will eventually add more inflammatory load on your brain. So if you have, say, an infection, right, and it's just going on and on, the number of or the amount of inflammatory cells in your body go up. That leads to an inflammatory load in your brain. So your brain thinks that it is under attack. And so it will release more, or it will lead to the release of more cortisols, more inflammatory cells. And inflammatory cells have a feedback loop in the brain. So whenever you have fever, why do you feel so low? Why do you feel like I don't want to do anything? So that's the inflammatory cell feedback in your brain saying conserve your energy, don't do anything right now. So if there is chronic inflammation, your brain goes into that state of lower motivation. as opposed to if you are not in an inflammatory state. Now, one really important thing that we have learned in the last 10, 15 years is that depression is an inflammatory state.
Wow.
So when somebody is depressed, their brain is acting as if it is under attack. It is as if there is an infection going on, even though there's actually no infection going on. So that there is a chronic inflammatory state happening in the brain, and that is what leads to certain parts of the brain shrinking. So your memory problems can happen because the hippocampus area in your brain starts to shrink in depression. There is a part in the prefrontal cortex called as DLPFC, which is dorsolateral prefrontal cortex, that is responsible for attention and working memory. That starts to shrink in depression because of chronic inflammation. So that's why you're not able to focus on things long. If you hear something, you'll quickly forget it. All of that is because of that shrinkage because of inflammation. So yes, chronic inflammation can have a direct impact on the brain.
Okay. Wow. So let's start with, you started with the age brackets and what comes early, right? And the one that you picked out was saying that a lot of youngsters come to you with regards to pain related conditions, right? Be it around, bad posture leading to starting to that, and then all the way to migraine. I want to talk a little bit about migraine, right? Everyone gets headaches, right? So what's different between a migraine and a headache? And, how do I know that I have a migraine and not a headache? Like,
Sure.
because I have to self-diagnose before I decide, okay, I need to go and see a doctor, or I just like dismissing it as headache and then I'm just living with it. Because I've heard a few cases, people who are not that well informed, right? They took too long to get treatment for something like this, because they couldn't ascertain that whether they had a migraine or not.
Yeah. So in general, if you have a headache that is repeating often enough to interfere with your work, you should get it tested. I would definitely not recommend anybody diagnose themselves. Just go meet an MD physician or a neurologist and just have it checked out.
Okay.
Because very often headaches can be a result of something more serious, like say your blood pressure having gone up or the pressure in your brain going up, which is called intracranial hypertension. So there are other reasons for headache as well. And while they are rarer and migraine is much more common, you still don't want to risk it, right? Especially since the testing is so easy. It's just one visit to the doctor, they will check everything. So don't self-diagnose headaches, especially if it's repeating again and again. That being said, the characteristic features of migraines.
Sorry to interrupt you there. Like when you say headaches repeating again and again, you mean what? Like once a week it is happening, or once a month it is happening? Or like, the people out of stress also, I don't know, they can get.
So usually what happens is that everybody starts figuring out what their headaches are like, right? So for example, I know that if I am dehydrated, so if I'm out all day, say I'm playing something, I didn't drink enough water or I didn't get enough sleep, the next day morning I can have a headache. Now that is something that I know has happened in the past. I also know that if I do this, if I just drink water, I'll get better and then I'll be able to get back to work. For me, that is not something that I'm worried about. But if that pattern breaks, if I'm just working in my office and I'm suddenly getting a headache, I don't really know why it happened. And I'll take a painkiller, it gets better. After a while, it just happens again. If something is not explained, I should go to a doctor. If I'm getting headaches every week, for example, without any clear reason, I'm living my normal life, but I'm getting a headache. There's no reason why it's coming. I should go to a doctor. I should know why a symptom is happening. That's basically what I mean by that.
Okay.
Right.
Okay. So I can ascertain the cause, or like I had drinks last night, so I'm having a headache in the morning. That's fine.
Correct.
Right. But if it's like I'm not able to explain why it's happening, it's just happening out of the blue.
Correct.
Just stop guessing it and go to a doctor.
Correct. A very simple example is, say if you're walking in your room and you stub your toe, you hit your toe against the edge of the table and your toe is hurting. You won't go to a doctor for that. Like there's a cause and effect. You hit your toe is hurting. But if you're sitting and watching TV and suddenly your toe starts to hurt, you should go to a doctor because your toe is not supposed to hurt just like that, right? So
no one thinks about the head side of things like that.
Exactly, but you should. It's exactly the same. If there's a cause, you know that you did this, that's why this has happened. Fine, wait for it. But if I hit my toe is hurting, and even after 24 hours, it continues to hurt. This is unusual because it should have gotten better in half an hour. That means maybe I have fractured a bone. Please go to a doctor.
So that's interesting because, I've always, the common story around migraines is that if you have light sensitivity, then you have migraine. Otherwise, you don't have migraine. Is that true?
That's partly true. So that's what I was getting at, that the characteristics of migraine are very easy to explain. But the tricky part is that not every patient has all these characteristics. Okay. So some of the characteristics are that you can have headache on one side of the head. It can be a pulsatile headache. So it'll come and go. It'll feel like it is throbbing inside your head. You can have nausea. You can feel like you might throw up. You can have sensitivity to light. So light can be very bright. You can have sensitivity to sound. So even a normal sound can seem very loud. And it can be distressing. So the headache is so bad that you're not able to work. You're not able to talk to people. You're very irritable during that headache. It can last for 8 hours, 12 hours, sometimes a day, right? So these are some of the characteristics. Not everybody has everything. And some people, unfortunately, have something more called aura, which is before the headache or right at the start of the headache, they can have flashing lights in front of them. They might see zigzag lines. They might see colored circles, halos. So these are all different things that migraine patients experience.
Okay. So is this like what? Migraine is like just an incident that is just like randomly happening with you, or is this like some kind of disease? What is this?
No, it is a disease. But what's interesting is our own understanding of migraine has been changing over the last 20 years. So for a while, it was thought that it's a stress response because when somebody is stressed out, they can get it. But our current understanding...
Honestly, up until now, that is what my belief was.
Correct. And there is some truth to that because stress can trigger migraine. But stress is not the same as migraine. Okay, so there's a difference. So our current understanding of migraine is that it is a autonomic neurovascular event. So let me explain what that means. There are blood vessels in the brain, right? And those blood vessels, how dilated or constricted they are depends on the nerve supply. Now, there is a nerve supply called the trigeminal nerve, and that is controlled by the autonomic nervous system. Autonomic nervous system is our body's response to the outside world. So if you are very stressed out, your autonomic nervous system gets activated, right? That is what makes you get ready for war. So if somebody is coming to attack you, your autonomic nervous system is what reacts first. Even before any other part of your body, your autonomic nervous system will react before anything else. That autonomic nervous system controls certain blood vessels. So if you are stressed or if there is a trigger, and that trigger can be even a smell or the sound of something, that can trigger your autonomic nervous system, and that will lead to blood vessels in your brain dilating and constricting. And that is what we experience as pain. This is our current understanding of migraine, but it is constantly evolving.
And is this treatable?
In a word, I would say yes, it is treatable, but it is not curable. There is a difference. It's not like you get malaria, I give you a medicine, you are done, and you no longer have malaria.
You can't prevent the trigger.
Yes, so you should first know what the trigger is, and then you have to do a lot of lifestyle changes to minimize that trigger, right? There are patients of mine who had migraine and who now no longer are affected by it. Some of them are still on medication. Some of them have stopped medication, but they still have to continue certain breathing practices, certain lifestyle changes in order to make sure that they don't get migraine. But they now know their disease well enough that they know that if I do this, I will get it. So they simply avoid doing those things.
And then are there medications to give you symptomatic relief?
Absolutely, yes.
Okay.
There are excellent medications. There are medications that you take only when you get an attack, and there are prophylactic medications that you keep taking so that you don't
get an attack. Okay, that is also something you need to know actually.
Yeah.
Okay, so coming to going a little further down the road on this, right? One of the things that has been recently has come to fore and in spotlight is basically strokes.
Yeah.
Right. We saw a very famous businessman, one of the Kamath brothers from Zerodha. He also at a very young age got stroke.
Yeah.
And what is surprising about this is like you said, generally you see it in 60 plus bracket becomes very common there. It is kind of scary for a youngster to feel, like someone that fit got it. What chance do I have? If I'm going to get it now, I'm going to get it now. So that leads to kind of like a, thinking or saying that like, okay, fair, we'll see if it happens, otherwise, why do we need to bother about it? So is there something that someone needs to, is that a thing that a 30, 40-year-old should think about?
Yes, absolutely. So that way of thinking is wrong in that there's nothing that I can do. It's not like that. It's all a matter of risk. So if you see somebody getting into a car crash, you can't say that, oh, car crashes happen, so what's the point of driving safe, right? Yes, even if you drive safe, things can happen, but it reduces the odds of something bad happening to you. If you wear a seat belt, it reduces the odds of you getting injured, right? So you should, and life is all about that. Life is all about reducing the odds of something bad happening. It's not all or none. It's not like if I don't have complete control, that means I have zero control. That's
Correct.
Not true. So the way I would put this across is, what are the things you can do to reduce the odds of a stroke? So we already talked about inflammation. So the more inflammation you have in your body, the more the chances of stroke. Because then the blood vessels can get clotted up easily because of inflammation.
So since you actually, it might be helpful for all the viewers to actually understand, physiologically speaking, what is a stroke?
What's a stroke?
Because like a heart attack, you can use, people are like, okay, blood clot goes there, you can get a heart attack. What is a stroke?
It's exactly the same. Replace brain and heart and you get a stroke. So every part of your body requires blood in order to function. If for whatever reason that blood supply gets stopped, you get an infarct, which means a part of your body that is not getting enough blood supply. So that part starts to die. Now, whatever job that part was doing, now you will no longer be able to do. So if the left side of my brain stops getting blood supply, I will not be able to move the right side of my body, which is called a paralysis, right? So why did the blood supply stop? Because something was blocking the artery. That can be a blood clot. So the most common reason for this is a blood clot in the artery. That's what causes a stroke.
Well, I was under the impression that there is no blood in the brain.
Oh no, that's not true at all.
That's not true?
No.
Okay.
Every little inch or every centimeter of the brain requires blood.
Okay.
Yeah.
Okay.
What you are thinking about is pain.
Okay.
There's no pain inside the brain.
Because it can't feel itself.
You can't feel itself. Yeah.
Okay. Fair enough. So, in what does the symptoms of stroke manifest like? Like, is there any signs that am I getting? So one is, A is when I'm getting the stroke, what are the symptoms?
Yeah.
B is that like if there is something in my lifestyle that is leading towards a stroke, right? What are the early warning signs of that? So both A and B, right? Like in stroke and then before stroke, what are the things that could be happening?
Yes. So let's take it question by question.
Yeah.
The first question would be, what are the signs of stroke? And there are a lot of signs because every part of the brain is doing some different work. So if that part of the brain becomes infarcted, that is injured, then you will lose exactly that function. So in a way, it's like a puzzle. So every stroke patient that you get, when we were medical students, we would get a case and our job would be to talk to the patient and examine the patient and understand exactly where the stroke would be. And earlier when there was no CT scan or MRI, this was the only way to know. Now, of course, we can just do a scan and understand where it is. So say, for example, if the left side of my brain is injured, I will lose control over the right side of my body. But the left brain is also responsible for language. So if my left brain is injured, I will no longer be able to talk or understand what you are saying. If the right side of my brain is injured, my left body will get paralyzed, but I will also lose the ability to see patterns. I will not be able to understand the tone of your voice. So you may say something sarcastically and I will not understand it because the right brain is responsible for prosody, which is tone.
Wow. Okay.
Again, there are parts called as the cerebellum, which is responsible for maintaining balance. So if my cerebellum is gone, I'll be able to move my hands and legs, but I won't be able to walk because I'll keep falling down. So different parts of the brain will have different kinds of stroke.
Okay.
Right. Now, coming to how can you know or how can you prevent a stroke? The most important thing is to have a good metabolism.
Okay.
Metabolic health is the one key determinant of whether you will get a stroke or not, right? So what happens in a stroke is that there's a blood vessel, and inside the blood vessel, you can have inflammatory cells that will injure the blood vessel from the inside. So the more amount of inflammation in your body, the more chances of a clot. Once there is an injury, all the cholesterol, sort of the bad cholesterol in your body, that can come and start sticking to that injury. So if you have a high amount of LDL or VLDL, so they are markers of higher chance of stroke. So you need to have a low amount of bad cholesterol. And finally, what can help clean out the clots is antioxidants. So if you are not having a nutrient-rich diet, if you're not eating enough anti-inflammatory substances, antioxidants, and if you're not exercising enough, if you're not moving enough, then those chances of clots can increase. So these are the metrics by which you can see if somebody's at a risk of blood clots or not.
Okay, fantastic. So basically maintain good metabolic health, right? And keep your cholesterol in check. That will be like really helpful.
Yes.
Fair. Coming to the third piece, which is on Alzheimer's.
Yeah.
Right. What have you seen in very early cases of Alzheimer's? What kind of symptoms which are deviant from the normal person's behavior that you start seeing, which should, start worrying a person, saying that, okay, like this is not right.
Yeah. So all my Alzheimer's patients, almost universally, I have found that they will come to me, the relatives will come to me with complaints of dad has started forgetting things, and they will always say it's been since 3 months, okay, or 4 months. And every time when I question in depth, you'll find that their memory loss has actually started around 2 years ago, 3 years ago. But those initial memory loss moments, nobody even considered as important because itna to hota hai, this much to happens, right? But if you question properly, you will know that it's earlier than they think. So yes, you should absolutely keep an eye out for early signs of memory loss. It usually starts with forgetting some names. So forgetting names of people that you haven't met in a while, that can happen more and more. Now, occasionally forgetting names is normal. We all have it.
I'm bad with names.
Correct. And that's okay. But if there is somebody that you are meeting with, say once a month, twice a month, and you suddenly forget their name, and it's happening again and again, that's a sign. It doesn't mean that you have Alzheimer's, but it's a sign that, oh, you are heading in that direction. So is there something that you can do? Can you take more care of your health? Right? So it's again not all or none. You don't have to be completely Alzheimer's to diagnose Alzheimer's. You can always have a pre-Alzheimer's, like a pre-cognitive.
So what is a confirmatory diagnostic test for Alzheimer's, like for someone that early?
It's a clinical diagnosis. So there is no scan that you can do to diagnose it. There are clinical tests. So there are memory
but
tests.
But physiologically, it is about your brain is kind of like, I might be wrong here, but isn't Alzheimer's about your brain essentially reducing or some cells dying in your brain, and it actually is in advanced stages. It's visible in scans.
In very, very advanced stages, it is visible in scans, but even then it is not diagnostic.
Okay.
Because a scan of an 80-year-old man will look shrunken. But from the scan, I cannot say for sure that this person has Alzheimer's.
Okay.
Until I speak to them, I can't diagnose.
So it's clinically, completely
It's a
clinical.
Correct. Because it is a network problem. It's not just that the brain is shrunken. Even a shrunken brain can work very well. It's all about how the connections inside the neurons are working. So that you cannot tell from an MRI. Maybe in the future, there will be scans that can show you at a network level where are the functioning neurons and where are the neurons that are not functioning. Maybe then we'll be able to diagnose Alzheimer's from a scan. We are not there yet today.
Okay. There has been talk around like some kind of blood test coming in for finding in early signs of that, and also are those part of the clinical practice yet, or they're still in the research side of things?
There are certain blood tests that can detect a genetic risk of Alzheimer's. So there are certain genetic profiles that have a greater risk. So for example, one of them is ApoE4 and ApoE2, if I remember. So these are certain genetic tests, also presenilin 1, presenilin 2. These are genetic tests that you can do to check if you have a risk. But I would still say that suppose if you find that you don't have a genetic risk, does that mean you won't get Alzheimer's? That's not true. If you do have a genetic risk, one good thing that might happen is you might end up taking more care about your body and your brain, but you should do that anyway, right? And a risk of that is if you find that you might have it, what if you take that in a negative sense and say that, oh, it's inevitable now, what's the point? Because human beings can take any information in any way.
Yes.
So I would still say that the advantage of doing these tests are not very clear. It's still an open question. And the end result is that you should take care of your brain, irrespective of your genetic profile. So that should be the part that you focus on more rather than figuring out all of these tests.
So that kind of brings me into, talking about a very interesting topic we were also discussing before. So we discussed, taking care of your body and how taking good care of your body also helps your brain, right? But in itself of taking care of brain, right? So as to almost like saying what is preventive brain health management, right? What is preventive neurology, so to speak, right?
Yeah.
What is there something like that, or is that a field? How do you think about that, essentially taking care of your brain, so to speak?
I think that's probably the most important question that you or anyone can ask in the 21st century. What is preventive neurology? We have already started talking about prevention in other fields. So we've started talking about preventive cardiology, right? We have started doing early tests. We have things like treadmill tests to know how strong your heart is. Are there problems? People do angios. If they get a bit of chest pain, they'll go and do an angio. They'll check if are there blocks. They will put in a stent. They'll start early medication.
Correct.
So cardiology has really advanced its preventive aspect. I feel the other fields are still lacking. It's catching up slowly, but where is the preventive pulmonology? How do you prevent your lungs from getting damaged? Where is preventive orthopedics? Where is preventive neurology? Where is preventive psychology? How do you prevent somebody from getting anxiety or depression, right? Is it even possible? So those discussions are a necessity.
Okay, so clearly preventive neurology is an important aspect of our lives that we need to look into and start working towards. So what would it be like for someone to attempt at?
So there are a few things which have a large ROI. So I like to think of it as what are the things you can do that has the maximum benefit. So the first thing would be to optimize sleep. I think beyond every other intervention, good sleep has the maximum benefit and bad sleep has the maximum risk. when it comes to brain health.
Mhm.
So optimizing your sleep would be step one. Step two would be to optimize your diet. And here I would say you have to get yourself regularly tested.
Mhm.
So at least for me, this has become the norm. So once a year, I'll get a full body checkup done. And whichever metrics are off, you keep track of it. So year on year, you try to track the important metrics, and whichever ones are off or they are going in the direction of problematic, you repeat them 3 months, 6 months. It's not an overkill at all. Just to know that how has your last 3 months of diet been? So the best way to know if you're eating in the right direction or the wrong direction is to get your sugar levels, your insulin levels, your lipid levels, your B12 homocysteine levels checked. And this will give you a very clear idea on should you change, because our body is very adaptable. So if you eat badly, your body can take it for a long time until it suddenly can't. So you don't want to wait till you have reached the end point. So there are early signs of deviation that you can pick up, and unfortunately you can only pick that up using tests. You can't wait until you feel bad. That is, if you are feeling sick, it's already very late.
Yeah.
So you should check before.
Some of the tests that you mentioned are quite interesting. So, general full body checkups would have like cholesterol and all of these things, right? But then we discussed homocysteine, for example. It's not a standard parameter inside a package, right? Are there any other such tests that get missed in common packages? So one is homocysteine. What does homocysteine do? What are we checking there? You had mentioned cortisol, right? Is there anything like that else? And if you could just explain a little bit what these parameters mean, generally speaking.
So cortisol is not something that I regularly check or track, because the problem with checking hormones is that they fluctuate, right? So I don't check cortisol regularly, but the tests that I do quite religiously every year are sugar levels, obviously, but fasting insulin, because fasting insulin is an earlier predictor of like a problematic glucose metabolism, even earlier than HbA1c.
Okay.
Right. So HbA1c will tell you if your sugar levels have been high for the last 3 months, but fasting insulin is what precedes that. Because insulin is the hormone that is responsible for glucose metabolism. So only when your insulin levels start growing up, that is the sign that you need more insulin to deal with the same amount of glucose. Right. So that is a better marker. In terms of nutrition, vitamin B12 is useful, but when vitamin B12 goes down, your homocysteine levels go up. Now, homocysteine is kind of an inflammatory molecule, because homocysteine itself can cause strokes.
Okay.
So you want to keep an eye on homocysteine, and if it's going up, then something has to change. So in your nutrition, in your B12 supplementation, you need that, because you need B12 to metabolize homocysteine. Similarly, when you do your lipids, so more important than your overall cholesterol is your LDL levels and your ApoB. So these are...
ApoB is also not a standard in packages.
But it should be, because ApoB as low as possible, LDL as low as possible is the new guideline. So earlier it was that, LDL should be around 100 or less than 100. But now, no, lesser the LDL, the better.
Okay.
Right? And ideally with diet. So eating right so that your LDL is low. Triglyceride level is a great metric for how much carbohydrates are you taking. So if your triglycerides are high, that means you're consuming a lot of simple carbs. So that has to come down. Increasing the number of amount of complex carbs that you eat is important. So that all these metrics tell a story. And if you keep checking this, then you'll know that the last 3 months ka diet has been working or not.
Fair. And so I think we said sleep, we said diet, and then is there anything else?
The third one would be movement. That is exercise.
Back to racket sports.
Yes. So back to racket sports. Not just racket sports, you also need to build muscle. So this is now a non-negotiable. There are now enough and more studies showing that muscle is important. Muscle is where the metabolism happens. So when you're eating, all that carbs, all those calories get burnt in the muscle. So if you have active muscle, then your overall metabolism improves. Plus, muscles produce certain proteins that directly impact the brain. So there are certain chemicals that our muscles produce which are directly impacting the brain. So just like we discussed in dance, this act of physical exercise itself can be a protective factor against even mental health issues.
Okay. And you're saying that like even having good muscle, there's a lot of study that has shown that it is useful in maintaining your insulin and sugar level.
Yeah.
Per se. So
Yes.
it's very important to hit the gym as well.
Absolutely. Yes.
Okay. Fantastic. So we covered all the three pieces around this thing, which is there is sleep, there is good eating habits, and then there is exercise, right? On just for a minute, coming back to sleep, right? I think it's a very ignored facet in today's world. There's a lot of, doom scrolling at night. You keep yourself awake till night 1 o'clock. What is the problem? I mean, I'm lying down. I'm unwinding. I had a long working day. And I want to unwind a little. So I end up watching screen for a bit of longer time. How does that? Is that harmful?
Yes and no. Unwinding is always useful. You want to switch off your brain, so to say. But not all forms of unwinding actually let you unwind. So the problem with a lot of scrolling is that it is still taking away a lot of your attention, and it's keeping you very, very alert. So it's not like you're reading a book where you are sort of going into a world and you're just staying there and letting your mind rest. What reels and scrolling, especially doom scrolling, does is it keeps you constantly jumping from thought to thought to thought. You have to reinvest attention again and again, and that can be exhausting. So I get a lot more tired scrolling than, say, if I'm watching a movie. It can be much more tiring, and plus it really interferes with your sleep, because when you are scrolling, you are sort of in your autonomic sympathetic zone. You are still excited, and sleep is the opposite of that. Sleep is rest. So for me to go into sleep from a very excited state is more difficult.
Physiologically speaking, what is the benefit of sleep to the brain?
It's basically rest and recuperation or recovery. So all the ideas that you had throughout the day, in sleep, they get connected. New ideas can form. Also, all the metabolic waste that your cells produce in the brain, they get cleared out at night. So there's something called as the glymphatic system. So that is the sort of like the drainage of the brain that is active during sleep. So if you're not getting sleep, all those toxins, all those waste products are still in the brain. They start getting collected, which over a period of time could be one of the reasons for Alzheimer's.
Okay. Yeah. And in your opinion, how many hours of sleep is enough?
I would say between 6 to 8 hours. So that is 4 to 5 sleep cycles. Each sleep cycle lasting for around 60 to 90 minutes. So 6 to 8 hours on a regular basis is good.
Okay. And so, having this sleep has become a topic. It's kind of like a trending topic now, and in social media on preventive health and otherwise. And as a result of which, a lot of new devices have come, which are tracking your sleep. Even Apple Watches nowadays, it tracks your sleep. And then there are certain rings that you can wear, which are tracking your sleep. How effective or useful are they with regards to managing your sleep, in your opinion? Or you don't need them, you just need to follow some basic habits and you're good enough. Like how in your approach, in your practice, have you seen any benefit of using these kind of devices?
So the benefit is that you get feedback and you get awareness. So right now the problem is most people are not even aware that their sleep is bad. Right? So they might blame their low mood or their lack of attention on other things. So the advantage of using trackers is that at least now you have evidence in front of you that your sleep quality is bad. So that is useful. A lot of people I know have changed their lifestyle because their trackers told them how bad their lifestyle was. So you need that. You need the feedback loop. Similar to why do we test? Why do we do blood tests? Because you can see that number and then you can't run away from it. You know that your sugar levels are high, so I have to reduce my sugar intake. So similarly, sleep trackers are useful, but would you do it every day? I wouldn't want to check my blood sugar every day, right? That might be too much. Similarly, I don't want to wear a tracker every day. I know there are people who do it, but that's a personal preference. For me, I find it sort of over analyzing. I think the more important thing is the doing rather than the tracking. So what I do is say once a week or once in 2 weeks, I'll wear a tracker to sleep and I will see if my sleep quality is good. Sometimes I'll wear it for 3-4 days at a stretch just to know. But it's my curiosity. I'll play with it. Like it's my body, it's my brain. I want data. I'll play with it. But the minute I find that, I'm stressing about it, I'm spending too much time on it, I let it go. Like what is more important is the actual sleeping, not the tracking.
And people say it's actually quite beneficial to sleep at the same time every day. Is that true, or is that just generic advice kind of a thing?
Anything that you do regularly, your body and your brain gets used to it, and that leads to less inflammation. Because your brain likes predictability, it likes routine, and if you are able to train your brain to a certain circadian rhythm, that is always better. But that being said, the quantity and quality of your sleep is more important than the timing. So even if 1 or 2 hours upar niche ho gaya, it's still fine. The quality and quantity of your sleep is more important.
Fair enough. Okay. And what are nowadays there is like these tests available for doing sleep studies at home, right? What are these? What is a sleep study essentially, and when is it recommended?
So a sleep study checks how deep your sleep is, how much time you sleep, at what level of sleep, how much time do you spend. So level 1 sleep, level 2 deep sleep, NREM and REM sleep. So these are the different stages of sleep. So it'll tell you how much time have you spent in each stage. It'll also tell you how are you breathing during your sleep. So there's something called obstructive sleep apnea, where there is a breathing problem. You don't get enough oxygen in your body when you're sleeping. And because of that, over a long time, you can have a lot of other issues. You can have headaches, you can have increased blood pressure, you can have mental health issues simply because you're not sleeping well because of this breathing problem. So the only way to diagnose this is by doing a sleep study. But it's not something that I recommend anyone doing by themselves. If you're having any of these symptoms, you should go to a doctor, and that doctor should recommend a sleep study. Because it has to be understood in the larger context of everything else, including your thyroid profile, including your weight, including your blood pressure. So everything has to be put together to understand.
Fair enough. On the matter of diet and supplementation, you mentioned taking vitamin B supplements helps with inflammation. There are also in market over the counter and also prescribed supplements for brain health. So are these supplements useful or they should be taken on their own? Because a lot of OTC sales are happening on saying that this will help you with your brain health and it's good for your mind and everything. Or should they be taken only on prescription essentially?
I would say as a baseline, no one needs supplements. Okay? As a baseline. Everything that your brain and your body needs can be achieved through diet.
Okay.
Every single supplement that you need, you can achieve through a proper diet. So that is the baseline. No one needs supplements. But there are certain supplements that are easier to use than getting a kind of diet that will give us all of that. Especially in today's lifestyle. If you're not able to have a complete meal every day, there are supplements that you can take. Now, if there's a woman who's 55, 60 and she's getting bone pains, she needs calcium, she needs vitamin D, you should use a supplement. So these are certain use cases where that there is either a nutritional issue or there's a chance of a nutritional issue, and you're not able to have a diet that can give you all of those nutrients, supplements is the way to go. So I would not say that I'm against supplements, but you should know what are you taking and why. You can't just be that, oh, these 5 things you should take just for a better life. No, that doesn't make any sense. If you know that I have a chance of B12 deficiency, I have a B12 report to show it, and I have the symptoms, sure, you should take it. But that's a clinical diagnosis, right? You can't just take random supplements and hope that
So like none of
something
those
helps.
brain health supplements.
No, absolutely not. I don't recommend it for anyone.
Okay. There is this ongoing lingo in Gen Z about, brain rot, right? Is this kind of like this mental fogginess and lethargy that is being stated, that is being felt by this generation a lot more? Is this a real phenomena, or is this like some social media trend, or what? And if it is real at any level, right? Like, what do you think are the contributing factors for something like this?
It's definitely a real phenomena in the sense that people are experiencing something, and this is what they have named it. So the way to
Sounds scary, brain rot.
Yeah, it is. And I don't really want to say it's not a scary thing, because it can lead to genuine problems. So basically what is happening is that you are scrolling on the phone, and because of the way that the social media algorithms are designed, it keeps your attention hooked onto the screen itself. And once you start to scroll, you find that you lose sense of time. You are no longer in the zone where you are paying attention to the things you should be paying attention to. And that makes you sort of a zombie. You're just there, you're just scrolling, you're not thinking about anything else. That's what brain rot means. You are not using your brain anymore. It's rotting. So all your attention is on the screen. Now with AI, brain rot can become even worse, because now even in the tasks where you are supposed to be using your brain, now technically you may not. You may just ask ChatGPT to give you some, little write-up, essay, whatever. If you want to write a resume, everything is right there. So you don't have to think.
It's like muscle atrophy.
It's sort of like muscle atrophy. Now this is a potential risk. We still don't know how it will affect, but there's a potential risk. That experience is very true though, of brain rot. I think we've all experienced just being in a couch and not wanting to move. So it is important to recognize it, and it is important to snap out of it.
So we're kind of like heading towards the end of our conversation, but you touched on a very interesting topic, which is AI, right? And in the world of AI, and there is a lot of discussion around topics like Neuralink coming in, us connecting to us as a machine in the chips, right? What are your views on first what this state is? Like, do you think it could be a reality that we wouldn't serve? I think there were some tests done in which a person was able to play chess, I think, or some other video game. And I think they were neck down paralyzed.
Yeah.
So is that something which is should we be even doing this? And what are the potential applications or something like this?
I would say not only is it a possibility, I think it is an inevitability that it will happen. Initially, it will happen only with those people for whom other options are not available, like patients with paralysis, for example. But more and more use cases will be discovered, because we are still in very, very, very early stages, right? We still don't know what all can happen. But the easiest or the lowest hanging fruits are moving things. Because that is the easiest commands, move left, move right. So playing chess, playing Counter-Strike, so a gun moving left and right, those things are much more easily done. Can a chip play music directly in your brain? We don't know. Possibly.
Or if you could augment that.
Yes. Can a chip, so for example, in the Matrix, Neo learns how to fight Kung Fu just because of a new program getting loaded in his brain. Is that a possibility? As of now, no. We cannot transmit knowledge in its entirety to a human being. But that's because we still don't fully understand how knowledge is transmitted or stored. But in the next 25 years, if our understanding of the human brain changes and technology also evolves, is it an impossibility? No, I think that can be possible. So we are in the absolute beginning of how AI and brain chips are going to get integrated. My worry is that human beings are traditionally very slow in adapting to new technology, in the sense that we may take it up for its good things, but we are very slow in recognizing the harm that it is doing all the time. So even before we have fully wrapped our heads around social media, we are already having to deal with AI and ChatGPT. And even before we have even understood this, we may have to deal with the complications of brain chips. And while there may be 10 or 1,000 people in the world who fully understood it, the remaining 8 billion would not really know what to do, right? Because my parents and that generation is still learning how to use WhatsApp and Instagram. And they are currently having to wrap their heads around AI generated videos. The disparity in the human species is so much. So the top 0.1% is creating AI, but its impact will be felt by everyone. And so the bottom 50% of people who are still wrapping their heads around computers will still be exposed to AI. Their brains are not ready to adapt to this. I think that is the real danger.
Okay, so this has been like a really fascinating conversation with you, Dr. Siddharth, on our mental health and overall brain health. I love the concept of preventive neurology, right? And it has we have had covered huge amount of space from starting from migraines to all the way to neural chips, so to speak. But my takeaway, I think, from this entire conversation is, I think the most important one is preventive neurology, right? I think, and how at the end of the day, I find confluence across various sciences on what is fundamentally needed. It's essentially us taking care of our minds, exercising, taking good care of our diet, overall, right? And then sleep has become very important, and I think that's a critical takeaway from today's conversation. Thank you so much for your time. I really enjoyed this chat with you.
Thank you so much for having me.
Thanks.
If you like the podcast, please hit the subscribe button or share it with someone whom you think will need it.